Diabetes in the Limelight Jamboree is just a touch of the conversation this morning. Joining us from the board of directors of the foundation are Dr. Adelia Bovell Benjamin and Rosetta Bovell. Good morning.
Good morning. Good morning.
Good morning to both of you and welcome to the show. How are you doing this morning?
We're doing fine. Thank you for having us.
It's a pleasure to have both of you on for such a good conversation, especially considering the history behind this foundation and the fact that you are going home after 15 years. But before we get to that, let's start off the conversation speaking about World Diabetes Day and its significance. Dr. Bovell Benjamin, can we start with you?
Yes, please. So, World Diabetes Day is UN designated day, and of course, it started with discovery of insulin. It started with the rising numbers of diabetes around the world, and every year on November 14th, it launches this campaign. You would notice that I'm wearing blue here, which signifies the unity of the global community in response to the rising number of people affected by diabetes. So the International Diabetes Federation, which is a world or the premier body for diabetes, hosts the World Diabetes Day November 14th every year. And we as an organization has become a part of this campaign. We were launched in 2008. And since then, we have been a part of this campaign and we have done several things which we will speak more about. So that up to November is Diabetes Month, where we are making all kind of thrust to global communities, global populations to take care of the rising number of people with diabetes.
And it's definitely something that does need to be addressed. Rosetta, let's bring you into the conversation this morning, talking about the focus theme this year is Know Your Risk of Type 2 Diabetes. Why is this theme so important?
But it is important because lots of people are walking around as has been shown, and they are not even aware that they are pre-diabetic or they are at risk, at great risk. So the earlier you get on board, if you know your risk, then you are aware of what can be happening to your body. Then you can adjust lifestyle and you can help in the global fight to stamp out diabetes.
Oh, it definitely is a global fight, and we see that the Bovell Cancer Diabetes Foundation is doing their part. And one of the things you're doing, of course, is hosting this event, Diabetes in the Limelight Jamboree. Dr. Bovell Benjamin, can you tell us a little more about this initiative?
Okay, so just by the way, just to preface it with that we started this organization because we were affected by diabetes, because we felt that our father who succumbed to complications from diabetes should not have passed at that time had we been more aware of diabetes and its impact. So our organization was started in 2008 again, and we started the mission really is to enrich the lives of people living with cancer and diabetes. And we do this by providing financial resources, support, preventive and management education. So over the years, we have been trying to accomplish this mission. We have been, this is the 15th year, we look at this event, Diabetes in the Limelight Jamboree, as our flagship event. So at this one, we do a whole lot of things to educate, to make diabetes prevention a routine thing for our lives or in people's lives. So we have been doing this. We have a whole series of activities that we do. We advocate to the local and national health system for community members. We go out there, we look for those who are at risk for diabetes. We conduct small group workshops all the time during the year. And it's all about educating, about letting people know that, you are at risk. We could let those who are at risk know they're at risk. And as you see, the slogan this year is know your risk, know your response. So we tell them how to respond to those risks. We have, I think our key tenets are our nutrition programs that we have. We talk a lot about healthy eating. We have a foot care program, which again is one of the complications of diabetes. We do that, we educate, we teach people to take care of their feet to lower the risk of amputation. And of course, we have to write proposals. We have to find funds to do our work. So those are some of the things we do.
Well, wonderful. It's good to see that you, of course, are taking the initiative. Now, as you mentioned, there are workshops, education, and so much more. How do people get access to this? Is it that you elect certain individuals or anybody can come in and apply?
Anyone, it's open to any and everyone. But a lot of times, what we have seen, when we were totally underground prior to the pandemic. During the pandemic, we adjusted quickly and we continued all our programs online. We try to advertise, we try to make the public aware that we are having an event. It's not special people, we invite everybody. We do have a database. Over the years, we have a database of over, I would say, almost 2,000 people who have participated before. We write them, we WhatsApp them, we email them. So we do try, just like we are sitting here on your program today, telling people about our event that's coming up. So we do publicize it and try as much to get everyone. So it's not just a selected few.
Wonderful. Rosetta, can you share more with us about the event that's coming up on the 10th of November in Roxborough?
Yes. On the 10th is our Diabetes in the Limelight Jamboree. And all are invited, Trinidad and Tobago. And at that jamboree, it's where people would come and you are educated. You go through the booths. We have lots of booths. First you register. That's step one in coming to the jamboree. You have to be registered and then you start visiting the booths where you go around, you visit the nurses' booths where you get your numbers taken. You are taken to our doctor's booth. From the nurses, you get the doctors. We have the eye specialists on board. We have our foot care booth where you are not only educated, you are examined, and some of the people there get to actually get their feet attended to at that booth. You visit, we have a stroke booth, we have our spin to win. That's the fun one where you are given little exercises, little activities to do to keep you moving. And the big one, we have the children's booth. It's where the school children come in, where they are educated through storytelling, interactive storytelling. And from there, after their storytelling, we have lots of activities for those children. We have food demonstrations. And of course, we have our weight booth where you get your BMI taken. So it's lots of activities. We have our education booth. And last year, we added our spiritual counseling where you can talk, you can go talk it out if you have problems. And there are so many other things you can do. Your cholesterol is taken. We do all those things to help people to be educated. And of course, you leave there knowing your numbers, you go to the education booth, you know your risks, and it is just a full day where everyone should become aware this year of the risk, knowing their numbers, how you can adjust, and being aware of the foundation's website where they can come to get support and, of course, gain knowledge of what can be done to change your lifestyle or adjust, not change. Adjust is a better word. Little tweaks to keep you there.
Seeing that there is a holistic approach to this, wonderful that you have incorporated spirituality into the conversation so that everybody will be able to hopefully access a resource that will guide them towards their better self and a healthier self. Now, Dr. Bovell Benjamin, one of the things that I'm hearing is there's so much going on with the foundation. We know that you've had a series of events and there will be more to come. So my question to you is, do you have any partnerships or collaborations that are ongoing that help to amplify the reach and also just get everything done?
Well, first, I must compliment, our volunteers are really one of our most important resources, but we work with other organizations every opportunity we have. We are part of the TNT NCD Alliance. We are a member of that. We have worked with the Trinidad and Tobago Diabetes Association before. We are part of the Healthy Caribbean Coalition. So we work with other organizations. We depend strongly on our volunteers. We have a cadre of volunteers. We just work them to death. And of course, we ourselves as the board of directors have to do a whole lot. And I must say that the board of directors, again, is a voluntary board. So that's how we get by. And we are not receiving, in terms of subventions, we do not get any subventions, whether it's local, international, or even regional. So what we do, we try to do the best we can. And I think with our volunteers behind us, we have volunteers from Tobago, we have volunteers, our bulk of volunteers are from Trinidad, we have volunteers from the United States. So we do have two strong universities behind us. We have Tuskegee University, we have volunteers from Georgia State University. So we work across the Caribbean. We would find a volunteer here and there. So that's how we do it. But it's a huge task, but we have to fulfill that mission. We have a duty, we have an obligation to do that. And whether it takes us all night, every night, we just do what we have to do.
Beautiful to hear. Teamwork definitely makes the dream work. Dr. Bovell Benjamin, Rosetta Bovell, thank you so much for joining us on the Now Morning Show. Looking forward to seeing many more great things come out of your foundation. Have a great day.
Thank you very much for having us. And we invite everybody to be out there on Friday 10th at Roxborough Sporting Complex. Hopefully we would increase our numbers this year. Thank you very much for having us.
It has
Thank
been
you.
our pleasure.
Thank you.
Good things are happening here on the Now Morning Show. Stay tuned. Coming up, we're going to be talking about re-energizing Trinidad and Tobago. We'll be back in a few.